Hi, welcome to Forged in Fundamentals. I'm your host, John Gray, and thank you for joining us here in this episode as we're going to talk about something kind of unique with a special guest, Daniel Walters, Dr. Daniel Walters, the pet PT. Thanks for coming on the show.
Thanks, John. Great to be here. Thanks for coming to my clinic to host the show. So I'm a animal physical therapist. I'm a human trained physical therapist, and I practiced in human medicine for 13 years. And fortunately, here in the state of Colorado, our Practice Act is very liberal. And so physical therapists in the state of Colorado can also work with animals. And, I got into this because my dog, Kona, she had torn her ACL about 6 years ago and was going to have surgery. And knowing that in human medicine, if we tear our ACL, you're starting rehab post-op day one. And so I had asked the vet, who said that, yeah, we can do rehab. I was like, is there such a thing like that for animals? And she said, yeah. And so referred me to a physical therapist. That was about 15 minutes up the road from my house. And I got to observe and ask questions and see, like, what was this all about? This looks like fun. I would love to do something like this. Animals is something of a passion of mine, and, they just enrich our lives. And, so that's kind of how I got exposed to it. And then it became a matter of having the time and the money and the resources to get the necessary training to get my animal physical therapy license.
What kind of training is that? What do you go through?
So in Colorado, they require, to get your license, they require a certain amount of veterinary medicine curriculum, a bunch of like clinical and observation hours, proof of that. And then there's also accredited certification programs that you can go through that can help you move toward getting your license.
Okay.
So you have your license and then you have a certification. So the certification is a credential that just kind of indicates that advanced training, that knowledge base and expertise. So I got that through the University of Tennessee. So Certified Canine Rehab Practitioner, or CCRP. So that was like a bunch of hours of didactic studying and information. And then it was a bunch of hands-on clinical work and an externship. So that's kind of what the training looks like.
Okay. And I mean, that's a lot it kind of almost sounds like a nursing program, right? Where you're going to do the hands-on portion, the clinicals, and then you also have the book side of things where you're learning all the material. Now, I think for a lot of people, especially whether you're a pet owner or, a working dog handler or something like that, physical therapy is like almost unheard of, So maybe just, could you tell us what you do as a physical therapist, both, maybe proactively and then also maybe after a surgery or something like that?
Yeah. So that's absolutely right. I think if you ask 10 different people on the street what a physical therapist is, you're going to get 10 different answers.
Yeah.
And, that kind of falls on us as a profession. Like, how can we better define what we do so that the public knows exactly where to go, how we help? It's really not, if you've ever been to a physical therapist or had rehab, it's really not that different from humans to animals. A lot of the same principles apply. Early mobility, strength, load, stress, like how do you manage that? Pain management, what do you do for that? And then also adapting to the individual patient. So every patient is different. How you bond with them is going to be a little different. The relationship that you have, you want it to be a trusting relationship, whether it be with a human patient or with an animal. That's what's going to make, I think, the biggest difference in better outcomes is what kind of relationship do you have with that patient? That's going to drive what they can do, how quickly they get better. So, yeah, from a rehab standpoint, if it's restorative, you're talking about injuries. They can be acute, they can be chronic, post-surgical conditions, degenerative, neurological conditions. So anything that impacts your mobility is where physical therapy comes in. And it can also be preventative. So don't wait until you can't move before you go see a physical therapist. If
Yeah.
you start, and part of it is kind of the education and understanding of seeing those maybe early signs of a problem, like early signs of arthritis. Like, is your dog hesitant to chase after the ball or jump in the car? Or do you see them have a little bit of difficulty rising from the floor? Do you notice that they're walking a little bit differently? Be proactive to go get them in and be seen by an expert in movement dysfunction. And that's the physical therapist. So
Okay.
that's like, movement is our thing. Like sometimes I have a hard time remembering names, but I'm much better at remembering what your gait looks like, how you walk. Like if I see somebody walking down the street, I'm like, oh, that's so and so. Yeah.
Yep.
But you tell me to remember their name, maybe not so much. So, yeah, experts in movement dysfunction, that's how we best define physical therapists and
Okay.
what we do. And then within that, we have subsets of various areas of expertise. So, we can specialize in orthopedics or neurology or pediatrics in the human side. And then for me, I specialize in animals.
Okay. And I think, for those of us that have experience having a dog that required physical therapy, I know that my working dog and a couple of the other working dogs that, we have had, maybe surgeries or medical issues. So a lot of it was post, like you said, like restorative.
Mm-hmm.
And now I see the value in that, right? Because I saw how fast it put him back at a capacity, I think, that he was even better than he was before, which is crazy to think about.
Mm-hmm.
But something I'm super fascinated in, and especially for the working dog handler side, right, is how can you think about mobility and getting your dog prepared to do something that can keep them from getting an injury,
Mm-hmm. Yeah. So that one, there are things you can do, but it's a little bit of a crapshoot.
Yeah.
Like you can't 100%
Right.
prevent an injury. Like I strained my back in the shower the other day.
Yep.
But like I can go deadlift, so like or work out for 4 hours. So it doesn't make any sense sometimes. But I think just understanding principles about workloads.
Yeah.
So like loads and stress and things that you're under, and not just physical, but emotional stressors. Like, did your dog have a apprehension last night? Like, was that a very stressful event? Was it a very exerting event?
Yeah.
Or was there something else that happened? So maybe take the next couple of days to de-stress and relax. That's kind of where some of those injuries happen. And also understanding, critical thinking and situational awareness, knowing what your dog's capacity is, or any sort of weak spots, like how high can they jump, or like their behavior. Some of those things I think are a little bit better at helping to prevent bad things from happening, like the anticipatory aspect of it. And also like screening. So just regular putting your hands on the dog, feeling them, screening for things, that's a great way to be proactive. Does something feel a little different, a little stiffer? Is there an asymmetry somewhere, that wasn't there before? So that's a great way to be proactive and preventative from bad things or injuries from happening.
Yeah, and that's something I think that I picked up from you when we were going through the process, is just understanding too, a lot of people with pets, they want to burn energy out of their dogs, right? And so they're like, oh, let's go play ball, right? So they go to the park and they just throw the ball with no warm up, right? There's nothing to acclimate the body to the strenuous activity they're getting ready to do. And the same thing's true for us, right? You could get your dog out of the car and have to go, search or go work, and the dog was just laying down in air-conditioned car 10 minutes ago, so now it's like, hey, I think more about acclimation how can I better suit, and like you said, you can never guarantee, right? But I can certainly try to use some of the information that you gave to acclimate the dog to what we're about to do a little bit better. And I
Mm-hmm.
think that that's something that people might not even know about, like flexion and mobility. How does that affect your dog just running after a tennis ball?
Mm-hmm.
You know?
Yeah. And the higher load, the higher stress activity of that. So, don't go for a 3 or a 4 hour car ride, then all of a sudden jump out of the car, throw the ball, and get them on a full on sprint. Right.
Yeah.
So maybe think about, okay, every hour or two, get up, stretch out, and then, like, after 5 or 10 minutes of walking around, throw the ball for a little bit, higher exertion activity. Yeah, that's a that's a great point. It's not
Yeah.
common sense. It should be.
You'd think, but I guess I'm also curious to hear your, going from working with people where you can talk and explain things to them
Mm-hmm.
to now working with animals where you have varying levels and types of communication.
Mm-hmm.
How do you manage that, and how do you work through getting dogs to do a lot of the things you need them to do, or any animal?
Yeah, it's not as complicated as you might think. It's actually a lot more simplistic in many ways, because there aren't as many. There are similar factors, but I would say there aren't as many with animals as there are with humans. If I ask a person to get up out of bed to go on a walk with me, that's like very medically complex. That was in the hospital for 2 weeks. That had a surgery, and they are like having, like, their son or daughter hasn't come to see them yet. So, like, there's a lot of different factors that go in. But with animals, I think once you're able to show, like, once you establish any sort of bond or trust, then it becomes much easier to work with them. So finding, and also asking the owners. So, like, one of my methods when I first see a dog or any patient is to just let them explore the space, sniff around. When they're ready, they come and greet me or check me out. And in the meantime, I'm talking with the owners. I want to find out what their life looks like, what their motivations are. Do they have food allergies? Are they treat motivated? Are they praise motivated? Do they like the ball? Is that their main motivation? And so kind of working with the owners first. And then I want to establish that bond and that comfort level and trust with the animal. And from there, it's pretty easy. Like, I can get them most of the time to do what I need them to do by praise, food, balls, motivation,
Yeah.
those different things. Whether it's a weight shifting activity, or I need them to get in a comfortable position on a cushion or on the floor so I can get my hands on them. So I would say it's pretty straightforward, but you got to have that calm strength, that calm presence and energy.
Yeah.
Like, I can't, it's going to be bad news, totally counterproductive if I'm nervous, if I don't convey to the animal that, hey, this is a safe space. I'm okay. I'm not nervous. Like, that, for them, it would be bad news. They would have a bad response.
Yeah.
So just maintaining that calm presence and strength, I think, is also very important.
I think, as a dog trainer, I see that a lot with people, where it's, the dog is chaotic, right? All over the place on the leash, jumping on people. But then you got to look at the energy of the environment, calm energy definitely produces a calmer dog.
Mm-hmm.
If you got kids jumping off the back of the couch, running around screaming, the dog's naturally going to be more excited, right? And it doesn't mean you can't train some of those things, but that's a good point. And I follow Daniel on social media, so I would suggest following, and I'll put that information up there. But I see a lot of videos working with some different animals.
Yeah.
What do you think the strangest animal you've worked with is, or the most difficult?
The strangest, I had a pet rat. So the actual, it's a fancy rat. That's the type of rat that it is. So it was a rescue rat from a lab, and it had a condition metabolic bone disease. So it was kind of like osteoporosis in humans. So it can fracture bones very easily. So it had fractured a leg, and we actually worked on his mobility. So, and then it fractured another leg a couple of months later. So just easy, like just a disease process that we kind of have to work around. But, you know, that again, like I talked to the owners to say, okay, help me understand what normal looks like for a fancy rat. Like, how do they move? What sounds do they make? Like, how do they communicate? So the owner was able to tell me, like, okay, there are certain movements or sounds that they make to show comfort or discomfort or responses. So then from there, it's again, it's the principles like, all right, let me set up an obstacle course. Let me have this rat go up an incline or down a decline to load the hind limbs or the front limbs. Let's set up a weave obstacle course. So they have to weight shift back and forth and move their spine a little bit. So just eat like, you know, not much different than what I would do. And even hands-on manual therapy, like feeling the limbs, feeling the body, doing some range of motions, very tiny.
Yeah,
Here we go. Range of motion right there on a rat. It was pretty weird, but it was also, it worked. Like the owner would tell me he's moving much better. Like this is working. This is helping in the owner's eyes. And that's also a very important aspect to consider. Like, what does the owner see? You know? So there's been some wild ones.
What do you think the most difficult animal to work with is as a physical therapist?
There have been, I've never been bit, but there have been some dogs that, you know, I try my best to avoid like a muzzle and things like that. It's very rare. And it's usually when the owner wants to do it. But there's been a couple of very reactive dogs that it was just hard to establish trust. So if we can't do that, then they're not going to do anything that I ask them to do. And then any sort of hands-on, like just to feel range of motion of a hind limb could be catastrophic. Like you know, they turn around, they try to lunge, they try to bite. Those are kind of the more difficult cases.
Yeah. And it's kind of wild to think about, you know, because you're working with a variety of dogs with different levels of training, right? And so some of the dogs you've worked with have been trained to bite people, right? Which definitely, you know, like you talked about exuding confidence. That's a key moment to do that, because I would imagine that it's a little bit nerve-wracking, right?
Yeah, maybe there's something wrong with me. I don't really get nervous. You know, like I don't shy away from that. I kind of lean into it actually. You know, that energy I kind of feed off of. So I actually kind of have an affinity for that, you know, to be able to get over that hump and to work with those dogs, to get them back to work faster, even if they are a trained bite dog. And, you know, like I also put my trust in the handlers. So like, you know, let's take a lot of time here and make sure we do everything right. And like the handlers, I mean, they're impressive people. You know, they like their heart and soul is in it. They understand to just the deepest levels their dog. You know, like that bond is just something that can make you emotional sometimes. So yeah, like I have to understand that and put my trust in that too.
Well, something cool that I learned from you was just like thinking about load, right? So getting a dog out of a car is something we do all the time, right? In and out of the car at work. And you had talked about how it's like, and correct me if my memory is wrong, but almost a 300% load jumping at a distance of about 18 inches. So
yeah, that's about right. Yeah, so the ground reaction force.
Yeah, and you figure, you know, for a dog that's 80 pounds getting in and out of a car, that's a lot of work on the front shoulders and things like that. And so I think about those things, and I think about, okay, longevity of a dog, right, who's in and out of the car all day for 8 or 10 years, right? That's a lot. So how can I maybe help him to build his front shoulders a little bit, to build muscle there, to take away from all the impact on the bone structure. So,
Mm-hmm.
it's cool to see the knowledge that you have and how when you give that to somebody, they can apply it in a number of ways.
Mm-hmm.
But one of the things that you did too, that I was hoping you'd talk about is like some of the laser therapy stuff.
Mm-hmm.
Do you feel like that when you work both of those together is when you see a lot more results from that?
Yes and no. So it really depends on the condition and the patient that you're working with. And by the way, cats. So cats can also be difficult sometimes. They can also be easy, but I have had some difficult cats too. Anyway, that was just another thought from the previous question. But yeah, if you're talking about passive versus active treatments, like if we just group those, and then with the passive treatments, that's going to be your modalities like laser, ultrasound, shockwave, electrical stimulation, TENS units, acupuncture or dry needling, all of those things. And then active treatments is going to be more like movement based interventions, exercise. That's when you think about loads and stress and doses of sets and reps and what types of exercises you're doing and why. That's where I think the expertise and the skill of the physical therapist comes in the most. On the human side of healthcare, there's been a lot of big major studies that look at efficacy of passive treatments like modalities or manual therapy versus active treatments. And general summary is that exercise works. Like, it's not a cure-all, but it's going to be the best method of recovery. So you always want to eventually get to active treatments because exercise is going to be your best bet for the best outcomes. Passive treatments can work well, especially in the beginning if there's a lot of discomfort or pain, if you're talking about pain management. Sometimes with chronic conditions, it's best to layer them in. So like do some laser or shockwave in combination with exercise to a tolerance that's good for them. That's a good dose of load and stress that can help maintain or improve or prevent decline in strength and mobility. So there is some efficacy for the modalities, but I will always say that exercise is going to be better. Like, you eventually want to get to that.
Yeah, that makes sense. I mean, it kind of, as far as I know, it's always been true that a body motion stays in motion, right? The more, and now, especially like with people, you see people have surgeries and you used to be in a bed for a period of time. And now it's like they want you up and walking shortly after, right? Because it's like they've got to get you moving, got to get your system moving. And it's pretty wild to see that that's true no matter whether you're a dog, a cat, a person, right? So when you work with animals here, and we'll get into specifically here at your new clinic, what's kind of your go-to for, let's say, I'm trying to think how I can give you some examples. What are some of your favorite exercises, I guess, to do for overall mobility?
Yeah. So I like Cavaletti rail step overs a lot. So that's usually a good first step kind of exercise that you can progress pretty easily in the clinic and at home. It's something easy that owners can do at home. So there's so many different uses for that exercise. So if you have a neurological condition or an orthopedic condition or post-surgical, that principle of weight shifting and coordination, and being able to load up maybe an injured leg in a dynamic way where they have to slowly step over a rail 1 foot at a time, and then eventually make the rail higher and then make them more uneven and then make them high enough to where they have to jump, so that progressive loading over many, many weeks, that's a great exercise. I also like various balance activities, working on stabilization and proprioception. That's also a very versatile type intervention for many different conditions. So if put them on even a mattress, like where they have to walk around a little bit, or balance equipment like inflatable cushions or peanuts, or like I can create various unstable obstacles. So, and then the last one I think is very valuable is step ups or like stairs. I like that one a lot too.
Yeah, it's kind of crazy to think about things that you truthfully don't think about, right? And how much they can impact your pet. And so the one that I thought was wild was the step overs, right? And just to see the dog's brain working, especially if they have an injury, okay, to lift every limb individually as they go over there. And I know specifically something we worked on was pace, right? Because some dogs everywhere they go are a bull in a china shop. They're just full for, and that's a more of a slower, kind of a methodical exercise, because otherwise they're going to be knocking all the poles off, right?
Yeah.
And so you usually set that up with like poles and cones and kind of stuff, right?
Mm-hmm.
Or I know at home when I was going through this with my dog, I would have to use a broom, whatever you could find to
Yeah.
get them to go over. But it was really neat to see how fast this leads to recovery.
Mm-hmm. I think that's a great point. Identifying being able to purposefully move, slow down, think about it. Because those dogs, like they'll take off, they don't, and like they'll take off and just pick up their leg that's holding them back, like I'm just going to go 3-legged so I can still move at full speed, but that's not going to help them learn. That's actually going to be detrimental to their recovery. Like you'll see muscle atrophy, you'll see tightness. And then when they do put their leg down that they haven't put down in so long, they're not used to that load. So then it's that bad cycle, of creating that negative feedback. So slow them down, make it purposeful, make them think about it. So that way they learn and get comfortable, and then we can progress it over time.
Yeah. And I think for people listening, something that you had mentioned earlier as a pet owner is super important is knowing your dog's normal gait, right? And I think I use this a lot because our dogs step on stuff, and you could be walking outside, and here in Colorado, right, there's thorns and all sorts of different things that could get stuck in their pads, and then their gait's different, right?
Mm-hmm.
Well, same could be true for an injury,
Mm-hmm.
and it could be subtle. So I think for pet owners just watching, if you really recognize the normal way your dog walks and then that changes, for me, I saw subtle things where all of a sudden my dog was only lifting one leg to pee all the time, right? Which was strange because I'm like, well, why are you only using, you're making an effort to spin around to only use this leg, right? And then you start kind of pairing those things together and you might be able to tell something's wrong, and so the gait was definitely a helpful thing to learn,
Yeah.
So I think talking about that though, what can people do to learn that about their dog?
I think being intentional about paying attention and doing hands-on work. So for like the paw pad example, a lot of owners may tell me that their dog doesn't let them touch their pads or cut their nails and things like that, when that could absolutely be the problem. It could be a nail that's grown out too long and cracked, or it could be a little sticky that's got in their paw pad, or they could have a little cut or something like that. So I think that, regular screening is very valuable. And the more regular you can do that, I think the more comfortable the dog gets with allowing you to do it.
Yeah.
So, like eventually get to those paws over time, because it's a very important thing, to be able to feel in the paw pads and wiggle the digits and look at the nails and do an inspection. I mean, at the very least, like if they won't let you put your hands on the paws, like find some motivation that like teach them how to give you a high five, just something quick that you can get a hand on, to also check range of motion, like active range of motion. Just kind of creatively thinking about that. But then I think having a conscious effort to pay attention to your dog's mobility, watch and listen and feel, like listen for any sort of whimpering, whining, cracking, popping of the joints. You could sometimes hear like a weight shifting that's offbeat, you know, and then watching it. And sometimes like slow it down. So if you need to take a slow-mo video, if you feel like something's just off, take a slow-mo video and see if you can identify something a little better that way. So that's another way to do it. And also good communication with your providers, your care providers. So don't be afraid to, I think it's extremely important to have a close connection and relationship with your veterinarians, with a physical therapist like me, where you can feel comfortable reaching out and get a response, or send a video and say, hey, I feel like this is off. You know, don't feel like you're burdening somebody by asking them questions. So if you're curious, if you have a concern, I think it's very important that you have those good relationships.
Yeah, that's a good point. Is there, you got me kind of thinking as you were talking about that. Let's say people that are listening or watching, and they have, maybe they're getting a puppy, right?
Mm.
As a physical therapist, you have a dog that's now physically developing. Are there things even at that time that an owner can start doing to help develop that dog the right way?
I mean, that young, I think just letting them do their thing is probably just as good.
Yeah.
But there are disease processes and things to be aware of, to watch out for. Like hip dysplasia is a big one to watch out for, other sorts of genetic conditions. So knowing normal versus abnormal. And with puppies, it can be kind of challenging because they're very green, they're very bendy, their growth plates are open. So it can be challenging, but they can also have soft tissue injuries. They can sprain an ankle or strain their iliopsoas muscle, just like older adults, just not as easily. But yeah, I think that I would say nothing specific for puppies other than just giving them guardrails.
Yeah. That's what I guess I always heard, not, maybe you shouldn't overdo it on a walk with younger dogs, especially dogs that are big, going to be a really big dog, not going on too far walks, not taking them running, where they're at a certain pace for an extended period of time, things like that.
Mm-hmm.
I think the walking is kind of interesting because, that's what they do, right? They walk all the time. So if they're not napping, they're walking, they're getting into trouble or cruising around. So, I think a lot of times it's just letting the dog maybe go at their own pace, rather than pushing them. I could see the running maybe being a little bit of an issue.
Yeah, that's a good point. So there's probably a lack of maybe good understanding that there are activity limitations for all of us. Like, I'm not going to take a 6-month-old puppy on a 14er. Like, I'm not going to hike them up a 14er, nor would I do that with my 12. Maybe I could do it with my 12-year-old dog. Maybe not. I need to understand those limitations. So a lot of it, I think, is common sense, but also general knowledge and doing some research and educating yourself on, okay, what's a normal activity level for this dog at this age? So what should I not be doing, or limits to where I might be overdoing it and risking their growth plates and overall health. But yeah, like that absolutely could be the case with some people not understanding that it's a dog, but they have limits just like us.
Yeah. Yeah, and a lot of people they adopt a dog, right? So sometimes you adopt a dog, you're unfamiliar with the dog too. Maybe it's not a puppy, it's an older dog. So you have a lot of things to now learn about this dog. And, it always kind of has made me curious about how diet and things like that also impact the inflammation in the body, which inflammation probably, I would imagine, directly impacts what you're doing, right? Because you're trying to reduce that and get the dog mobile fast. So, do you think that diet impacts the work you do?
Yeah, 100%. I'm not an expert in diet, but I could talk a little bit more on inflammation and inflammatory processes. So I do see a lot of immune mediated conditions where you deal with a lot of chronic inflammation. Or if it's a very active dog or the owners are putting them, like overloading them and overstressing them with maybe too much activity, then you also deal with chronic inflammation. So then you're talking about arthritis, whether it's immune mediated arthritis or osteoarthritis, just wear and tear, or if it's something where the diet is contributing to it. So I'm a big believer that you should find the right diet for your animal, for your dog. Not one diet's like great for every single dog, but having those nutritional principles absolutely helps. Like my dog had inflammatory bowel disease as a German Shepherd. And, she also, closer to the end of her life, had really bad arthritis. So you have to think that there are some systemic inflammatory effects, especially when you talk about the immune system.
Yeah.
And circling back, what's a great anti-inflammatory intervention? It's exercise.
Yeah.
Yeah.
Yeah. It's pretty wild to think about. A lot of this stuff comes back to mobility, which is what you're working on with these dogs. So before physical therapy, right? People would come in, they'd bring their dogs or their cats or whatever in, animal would have a surgery. Do you think that as physical therapy expands in veterinary medicine, that people will see across the board faster recovery times using the proper application and the homework that you're giving them?
Yes. Yeah, absolutely. And we've already seen it.
Yeah.
Yeah. It does, like, you want to be very collaborative. So veterinarians, they are the experts in animals. So especially veterinary surgeons that do, say, like a TPLO to fix the cruciate. Some of them have different perspectives on recovery time. Some are more conservative. Some are more comfortable with early mobility. So I want to be mindful of that and be collaborative. But we know, like on the human side, early mobility helps, like faster recovery, better outcomes, more robust, better outcomes as well. So we know that it works on that side. So in the like you could imply that it would probably work in veterinary medicine too, but that's not my place to say 100%,
Yeah.
But I do see it in practice. Like, it helps.
Yeah. So for people listening, if their dog maybe has an injury or had a surgery, or maybe it's just having difficulty, arthritis, things like that, are there a lot of physical therapists around?
No. So in Colorado, you can have a physical therapist that has their human license, in addition their animal license. And then we have to have medical clearance from a veterinarian to be able to see the patient. Veterinarians can also, they have a track that they can specialize in rehab as well. So you can get it either way. You can see a veterinarian that specializes in rehab or a physical therapist. As far as the actual physical therapists that work with animals in Colorado, it's very limited. So there is a growing demand and not enough supply. And there's been a very big gap in veterinary medicine in general. So there's not enough veterinarians, there's not enough vet techs to meet the demand of the care that the general public needs. So that's like part of why I started this business, is hoping to be able to better fill that gap.
Yeah, and perfect segue, because that's exactly what I was wanting you to talk about, is where are we right now?
Yeah.
So we're here at the Pet PT. This is your new practice, and we are in Castle Rock, Colorado. There's not very many physical therapists, like you just said, around. And so if people want to get more information, do you want to just talk a little bit about your business?
Yeah. So I'm located in Castle Rock, Colorado, inside Brooklyn Veterinary Clinic. So I have my own standalone practice that is inside the building. So my side of the house and Brooklyn Vet's side of the house. Right now, I have capacity on Tuesdays and Fridays to see patients in clinic. I also offer home visits for those that have difficulty traveling, or maybe a difficult case, mobility problems. It's just too difficult to get to the practice. Then I also have capacity to do remote visits. So virtual visits, remote therapeutic monitoring, that's also an option. I always emphasize it's going to be best, I think, to see a patient in clinic first, at least, before we do any sort of home visit, but I know that's not always the case. So my clinic hours are kind of limited right now. What I'm hoping is that I can grow and expand to full time. And then the clinic, we have additional space for growth and expansion as well. I've got an exam room. I've got a bunch of space for exercise. I've got an outdoor yard that's massive with agility equipment that is very therapeutic in general. And so my capacity right now is more of active treatments, exercise, hands-on, manual therapy, modalities such as neuromuscular electrical stimulation and TENS, moist heat, massage gun, things for like conservative things for pain management. But right now, no high dollar pieces of equipment like an underwater treadmill or shockwave. Hopefully those will come down the road as we expand. But, you know, it's like as much as I want to provide as much and the best care as I can, it's also a business. So I have to be fiscally responsible with what I'm investing in and when.
Yeah, absolutely.
Yeah.
And there's a lot of small businesses in Colorado. And, you know, I think everybody understands a little bit too that, you know, as you start out on your own and you start a business, there's always a little bit of you know, risk there. But the reality is this is such an important thing in medicine and veterinary medicine. And again, having seen the results, it's unbelievable, you know. So for people listening, I just encourage them, if you know, your dog doesn't have to have some major problem or your pet doesn't have to have some major problem, but this is worth it, you know, to come here and work through that. And the outside space is unbelievable. It's huge.
Yeah.
So what are your goals? Let's say, you know, for a year from now, what's the most important piece of equipment that you aim to get here shortly?
So my aim would be an underwater treadmill. I feel like that has the most clinical application for the most conditions, and we see really good results with underwater treadmill training. So that would be number one. I think number two would probably be a shockwave that also has a lot of very valuable clinical application, maybe more for like chronic conditions and more serious conditions like non-union fractures, things like that. Brooklyn Veterinary Clinic has a laser. So we do have laser capacity as a team. So I don't offer the laser here, but they have it. So that is an option as well. But yeah, underwater treadmill would be if I pulled the trigger on one high dollar piece of equipment, that would be it.
Yeah, I tell you what, there's always more things, right, that you could have or that you could need. But I think truthfully, just the knowledge that, you know, we were fortunate enough to sit down with you and kind of learn from you on the working dog side of things. And I feel like it was hugely beneficial. And again, as a pet owner, coming in and being able to see their dog recover at a rate that I don't think would happen if it wasn't for you is awesome.
Yeah.
You know?
Well, I appreciate that. And I think you just hit the nail on the head, is that I think the most underrated intervention that we can do as providers is education, like giving the owners or the public or your patients and clients that knowledge that they need to be successful. That what education are we providing? That's probably the most underrated intervention that we have.
Yeah, and I think too, you know, when people come in, maybe they might not completely understand, but every situation's a little bit different. But in terms of physical therapy, you do things here in the clinic, and then if I'm bringing my dog to you, I get homework, right? So that may differ depending on the dog's condition, but usually you're sent home with some things to work on, right?
Yeah, I try not to overload my clients too much with like club them over the head with 20 exercises. Methods, I usually try to give 3 or 4 appropriate targeted exercises for that patient. And we'll usually go over them in the clinic. And then I've got a home exercise platform that has videos, instruction, all of the guidelines, what to do, how often. And then it's very open dialogue. So like streamlined communication to help with that. So if we have to adapt, if like they're not responding to an exercise or it seems too difficult, we can adjust it remotely. So that's a very friendly capacity that I have with the practice that makes it easy on the owners to make adjustments on the fly. And just for them to know that like you can communicate with me pretty freely. Like,
Yeah.
I think that makes a huge difference in recovery, being accessible.
Yeah. And I think sometimes too, like, you'd give me some things to work on with my dog, and I'd have to, sometimes you got to get a little bit creative with how to make that exercise work for you, right? But again, the value is there and the recovery is unreal.
Yeah. Yeah. So, something like a rail, stepping over a rail, you don't have to go out and buy a set of Cavaletti rails. You can use a broomstick at home. The important thing is like, okay, what's the height that they're stepping over? How are you going about it? Are you slowing them down? Are you watching their weight shifting? It's not about the equipment itself. It's about how you do it.
Yeah. And it's wild too here, because obviously most people that don't know Colorado weather, it could be 70 outside and you could go outside and work on things, or it could be a foot of snow the next day. So you have no idea. And that also, I felt like, impacted my dog, and it still does, right? Because based on his injury, he's going to have long-term, unfortunately long-term effects from that, even working with him. And so, they're not any different from people. When it's cold, it doesn't feel as good,
Yep.
So for people to get more information on, do you have a website, right?
Yes.
What is your website?
It's thepetpt.com.
Okay, perfect. If I go on there, is there information? Am I able to reach out to you?
Yep. So my email, phone numbers published on the website, daniel@thepetpt.com, is my email that you can reach out to for more information. I have location, clinic hours, and how to go about getting in. So like I said, for me to see your pet, I would need medical clearance from a veterinarian. So you just can't come in off the street. I need a referral. So there is a referral form for veterinarians on the website. You can call Brooklyn Vet to schedule an appointment and have a veterinarian send over the medical record. And within that, we would need to get that medical clearance. So that's the main thing that I would need from just knowing if you wanted to bring your pet in to see me, that's what I need. All of that's on the website, easily done. There are links to the Brooklyn Vet website where you can schedule, where you can get more information. So you could also check me out on Instagram. The Pet PT is the handle. So you can kind of see firsthand what it looks like when we're going through physical therapy, what the clinic space looks like. So that's also available.
Yeah, it's an important thing. I think going on there, you learn a lot too, whether or not, just kind of watching you work with some of the other animals on balance, and, kind of working some of those areas where they need to build strength. And, my dog had a vastly different, muscle tone on his, hindquarters there. So it's like, oh, now I got to figure out how to build this up. And so, again, even for people just at home that have pets, it's good to exercise your dog. Exercise is much different than just letting them run around in the yard. They animals need exercise just like people do, and it's really important to build that in. And I think it probably helps when a dog is well exercised and has an injury. I would imagine that makes it easier on you to then bring them in here and get them through a recovery process sooner.
Yes, absolutely. It's easy for me to tell when owners are doing their homework or not. when
Yeah.
the patient comes through the door, I can pretty much immediately tell if things have been worked on at home or not. But I think you brought up a good point. Like, what types of exercise are you doing? Just take walking, for example. Imagine yourself hopping out of the car and sprinting around a field for 30 minutes, or getting out of a car and going on a deliberate, methodical walk for 30 minutes. That sounds much better, doesn't
Yeah.
it? And there's a lot of evidence that shows that that is very helpful. So, understanding what good exercise looks like on a regular basis, like for normal circumstances.
Yeah.
Yeah.
Might be a little bit different when it comes to cats, though.
Yeah.
Yeah. I mean, I don't know how you exercise a cat.
Yeah. That one's much more complicated. Yeah. I have seen a few people take their cats on walks, but they're a different animal. So we have
Yeah.
to approach it differently. Different motivations, different physiology. Um, so yeah, like sometimes it's the jumping is the biggest thing for cat owners, for them being able to jump up onto their tower or jump up onto furniture. That's one of the main things that I see for them.
Well, I'm telling you, if I would strongly encourage people, even for educational purposes, like I said before, we did that educational piece with you with the working dogs, to reach out to you, because there's so much information that, you've never seen so many working dog handlers in the same room that had never, put that much hands on their dogs, figuring out how to stretch their dog or do different things. But, they'll tell you when there's an injury or something happens and you've not familiarized yourself enough, it makes it harder on you. So super important. So I encourage people to reach out to you, and yeah, we appreciate you coming on the show.
Yeah, absolutely. And I'll just say, so with respect to the Instagram account, I do try to make it very educational. So a lot of my Instagram posts and reels and things like that, you really get a good why behind for the reasoning for why we want to do certain things. It's not just willy-nilly. There's a purpose for everything. So that's also, I think, a great resource to check out.
Yeah, and that's good, because in the world of social media, and we were just talking about this before the podcast, right? Dog trainers out there will definitely understand this. The 30-second videos of flashy things, or, oh, look how perfect this dog is, it is fine and dandy, but that's not reality, right? So for you to be able to put informational things out there for people and to understand why they should be practicing in this, or why this is valuable, is huge. So I'm always a fan of when people put real stuff on social media. So yeah, check them out on Instagram, thepetpt.com.
You got it.
Okay. And then all his information's on there. So thanks for joining us.
Thank you.